No crees que
Looks like we're live. Good morning, good afternoon, good evening, everyone. Welcome to our special live Q&A session in honor of the Spinal Cord Injury Awareness Month in 2025. I am Hanna. I'm the Director of Patient Services here at Verita Neuro, and I will be your host and moderator today. I'm very thrilled to be here with you, and whether it's you living with spinal cord injury or you're supporting a loved one or just curious to learn more, we will share insights and we will debunk some myths and discuss cutting-edge treatments for spinal cord injury. So before we start, I wanted to introduce our amazing panel of experts. So today joining us is Dr. Beatriz. She's our medical director in Verita Neuro Mexico. She's an expert in spinal cord injury and in neurorehabilitation. We also have Dr. Nasir. He's our global medical director joining from Bangkok, Thailand. It's nighttime here where we're located. So before we start, I wanted you doctors also to introduce yourself briefly to everyone.
Well, should I start?
Of course.
I'm Dr. Beatriz. I live here in Guadalajara. I'm one of the medical directors here at the clinic. I am a PM&R doctor, and then I did high specialization in spinal cord injury and neuro rehab. And I'm here to help you in this tough journey.
Mm-hmm. Thank you very much, Dr. Beatriz. Dr. Nasir.
Yes, thank you, Hanna. Good morning, good afternoon, good evening, everyone. I'm Dr. Nasir. I lead the medical team. Primarily, I'm located mostly in Bangkok, Thailand. I have research background in spinal cord stimulation and stem cell treatment.
Mm-hmm. Thank you, doctors. That's fantastic. I think we are good to start with the basics. So first up, why don't we cover the fundamentals of spinal cord injury? Dr. Nasir, could you explain what exactly spinal cord injury is and how it affects the body? And if you could, can you also explain to everyone what is the difference between quadriplegia and paraplegia and how they compare?
Well, spinal cord injury could be any trauma, any insult to the spinal cord, which could be traumatic or it could be non-traumatic. The most common cause of traumatic spinal cord injury are motor vehicle accidents, falls, and there is also a group of non-traumatic spinal cord injuries, which could be from spinal stroke or bleeding in the spine. So depending upon the location of the injury, it could either affect upper body functions or lower body functions. For some patients where the injury is at cervical level, it affects both upper and lower body functions, which is called quadriplegia. For some patients with lower level of injuries at a thoracic level or in the lumbar level, this is called paraplegia, which primarily affects the lower limb functions.
Mm-hmm. Thank you, Dr. Nasir. And now, Dr. Beatriz, could you tell us a little bit about the most common causes of spinal cord injury?
Okay, as Dr. Nasir mentioned, there are traumatic and non-traumatic causes. And in the non-traumatic causes, which are the minor cases or the least cases, that could be maybe a tumor, that could be an infection, a viral or bacterial. It could be after a surgery, and even it could be related to cancer or other chronic diseases. And for the traumatic, which is the rest of them, most of them that we treat here at the clinic, motor vehicle accidents is the number one. Falls from high altitudes is also the second one. Extreme sports, considering motorcycles, and also diving. Mm-hmm.
Building on that, Dr. Beatriz, could you also describe different types of spinal cord injury? What would be the difference between a complete and an incomplete injury?
Sure. we follow American Spinal Injury Association guidelines, which they use the AIS scale to see what kind of injury people have, this is the booklet that we use all the time. And this is the kind, like an international scale that people use. So we have here divided the motor and the sensitive functions. So there we divide the dermatomes and myotomes to see the motor functions and the sensitive functions. But what makes a complete differentiate from a complete injury would be the sacral segments, that is S2 to S4. And when we do this scale and we apply it to the patient, we try to find out if there is sensation in the sacral segments or even motor function. If we are lucky enough to find sensation over there, we immediately change from a A, which is a complete spinal cord injury, to a B, incomplete spinal cord injury. And from B letter through E, that's incomplete injuries that obviously have a different opportunity, or the prognosis is different.
Okay. Thank you, Dr. Beatriz. And Dr. Nasir, I wanted to ask you how the spinal cord injury is diagnosed, assessed after the initial trauma, how the first days and hours look like.
Yeah. So primarily, it starts with, of course, medical history. So usually there is a very obvious trauma in case of traumatic spinal cord injury. So it starts with the examination, and the most important method to confirm the location and nature of injury are spinal MRI and spinal CT scan. Usually both are done together, because both the spinal CT scan and MRI scan, they have their own advantages over one another. And usually during the first stage of the trauma, patients, they are in a state of, which is called a spinal shock, because of serious trauma. Many patients, they also suffer from extra medical conditions, because usually they have, as a result of, for example, motor vehicle accident, they may have polytrauma, they may have rib fractures, they may have other fractures, they may have spleen puncture, they may have lung puncture. So they are usually in a state of like medical emergency, and also they are in a state which is called spinal shock. So basically spinal cord shuts down, it doesn't function at all. So usually they are on a breathing support, they are on other life support. During the first few, usually after 24 hours, patients, they start to come back from the state of shock, which can last for a few days or few weeks. And during the initial stage, they may recover some of the functions. It depends on how serious the injury was, and usually it takes few months for us to conclude what is the lifelong impact of a spinal cord injury, because during first few weeks or few months, it's extremely difficult to determine the long-term consequences of a particular patient. Also within first 6 months, many patients, they recover a little bit of motor function. Sometimes they develop spasticity, which is an indication of some functional recovery at the level of injury. Some of the patients, they may recover sensory function. Again, it depends on how serious the injury is.
I think these are all excellent insights, and thank you both for giving us the foundations of the spinal cord injury. But I would like to move to life after spinal cord injury, which of course is a big topic for many people watching us today. Dr. Nasir, what are some most common day-to-day challenges that people with spinal cord injury face, of course, other than the ability, the lack of the ability to walk?
Yes. So usually, I think for from an outsider's perspective, it appears that maybe inability to walk is maybe the biggest challenge. But when you actually spend some time with spinal cord injury people, you can see they actually face very significant challenges which significantly impact their physical and mental health, which includes inability to walk or stand is one thing, which is major, but they also have blood pressure issues, they have issues controlling their body temperature, they have issues controlling their sphincters, they have loss of bladder and bowel function, they also have serious neuropathic pain, many of the patients. They also have spasticity, and then they have those long-term socioeconomic and other challenges. So these are, I think, some of the challenges they actually face on day-to-day basis, which have remarkable socioeconomic challenges, and also it also has significant challenges for the family members.
Dr. Beatriz, in your practice, especially as a rehabilitation doctor, you do spend a lot of time with spinal cord injury patients in your daily practice, and you do develop doctor-patient relationship with them over time. How would you say that spinal cord injury affects the mental health? How does it impact, and what kind of support is available?
Okay, as Dr. Nasir says, the beginning of the spinal cord injury, maybe being around SCI patients since 2006, I've noticed that the biggest impact at the beginning is not walking or not being able to walk, maybe for a time lapse or maybe forever. So this is what impacts at the beginning most, because that's what the neurosurgeon usually tells them or communicates them at the beginning. However, as the months go by and not being able to have a conversation face to face with someone, but rather looking up right from your wheelchair or from your bed, this brings them frustration and depression in the most of the cases, or even anger. Usually, in the practice, we recommend using medicines for this depression or for this anxiety, and also psychological support in sessions, maybe in group therapy or maybe individual. That would help a lot. It is very important to have very clear what a spinal cord injury is, so the patient really knows that this is a catastrophic event in his life or her life, and even to the relatives, because sometimes they think that things will get better in 1 month, and if it doesn't happen, they get really frustrated, or they're always comparing themselves with other patients, which is very frustrating for them, because they think that one patient is going faster than they are, or that they think that they will get better, or that they think that they're the minimum percentage that will make it, and that there was a wrong diagnosis at the beginning. So it's very, very important, the mental health, in order for the patient to be aware of what he's living and going through, and also to have this strength to go ahead and being involved in a rehab program, and get the best results.
I think you're absolutely right, and this is something we also see a lot with our patients struggling sometimes with day-to-day life, knowing that spinal cord injury is there, and the moment it really sinks in, it's becoming more and more difficult. I think what is also extremely important is the support of friends and family. It's very, very important to continue the social life, to see the friends and see the family, and try to live as normal as possible, of course, with a lot of physio and all of the precautions to be taken. Speaking of this, Dr. Beatriz, could you talk about what kind of assistive devices and what kind of technologies are there to help with the daily life after the spinal cord injury?
Yeah. Obviously, the availability depends on the country you live in. But worldwide, there are many, many technologies that can help you in every day, as simple as something called reachers. That's, for example, you can reach something, a hanger in your closet, a glass in the kitchen, help you put in the socks when you're dressing. We also have walkers or standing frames, which help a lot at home. And sometimes also the electrical wheelchairs are good. At the clinic, we usually help patients with e-pacers, which is like a walker, but helps you support your weight and also help you with the start standing and also starting to walk or stepping, not walking properly. Also, there are exoskeletons worldwide. There are a wide variety. They are good. They help the patient's mental health, also the bone health, respiratory and gastrointestinal, because you're in the upright position, and also the mental well-being, no, of being against standing. However, it's not a cure, and I want to be very clear that all of these are not a cure, but they'll bring you back to mental stability, to a reintegration socially, and they'll keep you more independent. And also, it'll help not to get those complications.
Right, right. Before I ask the next question, I want to let everyone know that I already see we have a lot of questions flowing in. Towards the end of the session, we will have time to answer all of them. So please stay and listen to the live, and we will make sure to answer everything we can towards the end of the session. Dr. Nasir, I wanted to ask you how people with spinal cord injury, how the survivors, they keep their muscle strength post injury. I think for those of you who are watching you and who know Verita Neuro, you are aware that we are strong advocates for physical therapy, regular and intensive physical therapy. So Dr. Nasir, could you highlight a little bit about what consistent physical and occupational therapy, what is the role of those therapies in supporting the overall health of and preparing for the future treatments?
Yeah, there are really true group of patients. Unfortunately, some patients, when they're told there is maybe no hope for recovery, maybe they are going to spend their whole life on a wheelchair. Some of them, not all of them, I would say a minority of the patient, they give up basically. So they don't want to go through the hard work of rehabilitation, because they ask, what's the point of going through daily training? What's the point of going through all of this rehabilitation? And but I would say a majority of the patients, they see hope, and they actually believe rehabilitation is a significant part of their recovery. This is what we also suggest, and I think every medical professional should advise their patients not to give up, because even without a cure, there is physical therapy, there is occupational therapy, there is other types of rehabilitations. It can at least prevent some of the complications, because some patients, when they don't perform any body weight training, they don't perform standing training, any weight bearing training, they tend to lose their muscle mass, and they are prone to having fractures, and they actually do get fractured. So sometimes they have those major hip fractures which they don't heal, and then it actually becomes, even after a spinal cord injury, it can continue to get worse for those patients, really. So I think they should try to minimize the further complications, try to minimize those musculoskeletal complications. Some of them, they may develop a lot of spasticity, so they may develop like those contractures, or maybe more skeletal deformities, scoliosis, kyphoscoliosis, and also they may have loss of muscle mass, they may have impaired blood pressure regulation, body temperature regulation, and also this can not doing any rehab I think it can have very devastating um, psychological impact. So for patients, we have noticed in our day-to-day practice, those patients who really wake up, they get ready, they prepare themselves for the day, they actually perform better. Even if there is no recovery, it can actually have very, very good mental uh, impact. So this is what we encourage to our patients. And there are a lot of complications after spinal cord injury, which could be prevented just by doing right type of physical therapy rehabilitation. In terms of your second question, we usually put a lot of focus on body weight training because, like Dr. Beatriz said, when patient they stand upright, it can have a very good positive impact on their cardiovascular health, on their GI health, on their blood circulation, body temperature regulation. It can prevent muscle degeneration. It can prevent bone degeneration. So this is what we actually advocate a lot. If someone is in a medically fit condition to perform upright body weight training, we put a lot of focus on body weight training. Then we also do a lot of stretching. We focus on, we believe, spasticity, of course, can be prevented, can be improved with aggressive stretching. So for our patients, when they start, we also do a lot of stretching for those patients. Then, of course, there are other set of exercises. But I think like consistent stretching and body weight training, these are by far, I would say, most important rehab tools we can use to prevent complications in people suffering from spinal cord injury.
I agree with you, and these are even though simple but very, very practical tips. So thank you for this. If anyone in the audience has any questions related to what we've been discussing so far, please feel free to drop your questions and we will answer them later. I think we already covered a very good solid foundation of what spinal cord injury really is. So it's time for us to also debunk some common myths about spinal cord injury that we hear almost all the time. So, Dr. Beatriz, I wanted to ask you, I know you mentioned this before, but there is a myth that spinal cord injury almost always results in complete paralysis. And there is also an idea that usually any recovery that you can see from spinal cord injury would stop after a few months. What are your thoughts about this?
Okay, so initially, as we mentioned before, there's a spinal shock, and after the spinal shock is resolved, we will get to know what kind of spinal cord injury the patient really has. This is complete versus incomplete. The complete versus incomplete relies mainly in the sacral segments, as we said before, not specifically in the motor function that the patient might have. But also this helps us a lot, the sacral segments, to know as a prognosis if we can change from a complete to an incomplete injury, which will have maybe some spare areas or myotomes that are still functioning, that is with normal strength, or maybe with a ability to keep on moving some muscles, or feeling the doctor or the practitioner feel some muscles that are working but still don't make a range of movement. So not all spinal cord injury patients have a complete paralysis. They might have an incomplete injury, and with the time, even complete injuries might turn into incomplete injuries sometimes. We do have some cases, which we are very fortunate and we're very happy for those patients, that with time, with the physical therapy, the pelvic floor therapy, and with other therapies that we'll be discussing later on, get to go from a complete to an incomplete injury. And usually when the spinal cord injury has happened, doctors usually talk about 12 months at the most, where you'll see the biggest changes or the only changes that you'll see. So patients sometimes stay, and also relatives stay with that idea. But since we've been working with spinal cord injury, I've been working in spinal cord injury since 2006, I've been very fortunate to see that patients do change, and that the cornerstone is the physical therapy. That's the most important thing. And nowadays that we have many breakthrough treatments, we can see more changes in less time. So not all injuries will have the biggest changes in the first 12 months. We do have patients that have been chronic, like five years from the spinal cord injury, or 20 years, and still, with some kind of our protocols, have changes, positive changes.
That's fantastic. Thank you, Dr. Beatriz. Dr. Nasir, before we move on to another part, where we're going to discuss treatments, I also wanted to ask you about probably the most common myth that we hear about spinal cord injury, which is that it only affects mobility. Could you elaborate on this?
Yes, sure. I think from initially, this is the impression that they're, because everyone can see them being on a wheelchair, for example, and everyone assumes that maybe this is the most impactful part of their life, which of course is true, but there are other aspects. I think loss of bowel and bladder function is very frustrating. Many patients we come across, they actually don't really care about not being able to walk as much as they care about not being able to control their bowel and bladder function. So I would say that because this can actually have very significant impact on their mental health. They feel depending on others for this private aspect of their life. This is one. Then cardiovascular health, suffering from like low blood pressure, being dizzy all the time. This is another very significant impact, I would say. When they wake up in the morning, they raise their head. Basically, they have to wait for a few seconds, sometimes few minutes, really to cope with the dizziness, because the blood pressure would suddenly drop. Then it takes some time for them to sit upright and then maybe move to a wheelchair, and then they are not able to perform like too much body weight training. They are not able to stand because simply they would have very low blood pressure. Then the third thing, the body temperature regulation. Sometimes they feel very cold, sometimes they feel very hot, because autonomic function is not really functioning, so they are not able to regulate their body temperature. And then there are other complications like neuropathic pain. Of course, could be very devastating. Some patients, they have very significant neuropathic pain, and spasticity also. Spasticity is a good thing because it helps with recovery sometimes, but it's also, it can also have impact. It can impact their quality of life. And then there are other complications like musculoskeletal deformities and fractures. Many patients are prone to fractures, so it's of course is equally devastating to have a fracture, like a hip fracture, where the fracture is not healing and there is maybe a normal fusion sometimes. So those kind of complications could settle in after a spinal cord injury. It's not only the inability to walk.
Definitely. And thank you, both doctors, for clarifying this and debunking the myths and giving us a good overview of spinal cord injury. I think this is still a common condition that we come across very often. So it's important to educate and not only the patients and the families, but also the society. This is a very important part of what we do, and education is also very close to our hearts at Verita Neuro. So I think this was much needed to just go back to basics and explain everything one more time. But shifting more towards innovation and towards the hope that is still there for spinal cord injury patients, I'm very excited to talk about the spinal cord injury treatments that we offer here at Verita Neuro. We specialize in advanced options like epidural spinal cord stimulation and LamiSpine surgery, as well as stem cell treatments, stem cell therapies. So all of them are designed to improve the quality of life, and in many cases also to restore functions. So of course, I will ask you doctors to help me break down all of those treatment options. So let's start, I think, with our most famous and probably a flagship treatment that we offer here at Verita Neuro. We are the only ones globally to offer this treatment in this form. So, Dr. Beatriz, could you explain what is epidural stimulation? How does it work? And how does the implantation of the stimulator look like in the spinal cord? And how do the signals from the stimulator help to reconnect the brain with the body? And also, please explain who is it for, what levels of injury, quadriplegic, paraplegics, any age limitation. Could you elaborate on this?
Sure. Well, spinal cord injury has to be solved. The initial shock has to be solved in order to start any kind of treatment, including the physical therapy. Okay. Epidural stimulation, as Hanna mentioned, is one of the most famous or maybe most attractive kind of treatments that patients always aim for or asking for. But unfortunately, epidural stimulation is not for everyone, and it's not since the beginning the first option, or should not be the first option. Why? Some patients feel like a little bit disappointed when we tell them that it's not our first option when they're in the early injury, but these are the reasons why. To begin with, the epidural stimulation is a device that needs an implantation, surgical implantation, that is in an OR, operating room, by very skilled neurosurgeons. It takes around 2 to 4 hours to do the implantation if it's only one device. It has 16 leads, which these leads have positive and negative poles in order to make some electrical combinations and amplify the signals in your spinal cord injury that have been lost. So this is a very important point because many patients are always asking if it's for only for incomplete or complete injuries. It's for both, but mostly we see most complete injuries and incomplete B-scale in Asia score. Mm-hmm. So the device is available, or in our experience, what we've seen, and in our study, we just launched a study in Brazil. It's better on patients from 12 years old, that was the youngest, to 55 years old. This is not a limitation exactly for the 55-year-old. If the patient is in general good health and has been a healthy person before the spinal cord injury and keeps on doing his physical therapy and has minimum consequences or complications, he or she might be also a candidate for ES. Mm-hmm. Okay, so we usually make a very personalized evaluation of the patient, on the medical records, and to see the general conditions that the patient has. So then we decide, a very important thing to decide whether or not the patient may respond to the ES is the presence of spasms in their lower body, to see that there is still some kind of connection that we can be able to amplify with the ES. So once that the patient has been decided to get into the ES because he or she is a good candidate, we'll move on to make other studies like a DEXA scan. And we do this because of the implantation of the ES, and because we will plan to move the patient and map or program this stimulator for the patient to stand up, maybe to try to block knees, to do a knee flexion. And as you might know or guess, at the beginning, the movements are not that smooth and pretty. They are a little bit rigid, or they're a little bit bulky. So we have to be very careful with the fraction. So we go through this very skilled and very detailed evaluation of the patient, and then we get the patient. The patient comes either to Thailand or to Guadalajara. They're intervened in the 2 to 4 hour surgery, and then they have to rest for a couple of days. So the implantation of the ES doesn't migrate. And after that starts the big marathon, which is the programming or the mapping, which is very, very, very hardworking, both for the mappers or programmers and for the patient, because it's 4 hours daily. And we try to find all these combinations from the polls that I told you before, from the 16 polls, to make come from the patient a voluntary movement. This is if the patient wants to make a hip flexion, some polls will make a hip flexion. So we are very detailed, and it's hard working. It's a lot of mental work for our mappers to find all these combinations, and also for the patients. You feel very tired, really, even when you don't think about it. And also, you combine that with physical therapy to see that the voluntary movements are working in the patient, and that will make them more independent and with better quality of life. So, what have we seen with the patients? The treatment with the ES, if it's only one single ES, is 35 days straight ahead. And if it's two ES, that's cervical and lumbar, that will be 55 days. So it's hard work for everyone. So you have to be very mentalized, because there are some days where you don't want to see anyone here at the clinic because it's tough. Well, what have we seen and the biggest changes? Yes, if you were using the cervical implant, will be mostly for gross motor functions. That is shoulders, biceps, triceps, and wrists. And maybe grabbing only, no, for the fist, but it's not for fine motor actions. And we also help with trunk control, with your abs, to help with the bowel movements and with the bladder also. And then in the lower implant, we always focus on the ABDs and ADDs, hip muscles, also the tibialis and the knees, the quads. So we help different functions. It is very important to understand this is totally different from an exoskeleton, because we're looking for voluntary movement. In the exoskeletons, or for example, the Locomat, which is Swiss engineered orthosis, the patient is not moving, and in the ES, the patient is moving himself. It's voluntary movement. So that's why we are very detailed, and it takes so long. Also, it is very important to know that when we do the ES on a patient, the treatment is not over after the 35 or the 55 days. The treatment goes along for years. The patient must use it many hours during the week, so you can really get the good results about it.
That's correct. And of course, I agree with you that epidural stimulation treatment is hard work for the patient and for the therapist. But luckily, with the kind of improvements we are seeing and the patients are reporting, it's definitely worth it. Dr. Beatriz, you've seen so many patients in your practice receiving epidural stimulation. Could you tell us about one patient that you particularly remember, and maybe give a little bit of a case study to our viewers?
Okay, I can think about two cases straight from my head right now. One of them is Sofia Corona. She is a cervical patient, and I'm giving her name because you can reach her in social media. She's very happy to talk about her case. She even wrote a book about her case. And she had an accident back in January 2018. She is a cervical patient. Her injury is C5. She had very, very, very hard car crash. And so she had a quadriplegia. And she got the ES a year after her injury. And she went to Thailand, because back then we didn't have this in Mexico. It was really, 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 really hard for the airports, because the airports are not for people in wheelchair, the bathrooms especially. And it was a hard flight because it took 20-something hours. Well, but she was very happy. She got very good results. Sophia right now is driving her car. Sophia uses her hands to eat, to do her makeup or her grooming. She helps with getting dressed. She feeds herself. She can play Jenga with her hands. She stands up. She takes PT now daily. She also goes to swimming, and she is able to party or go to social events by herself. She doesn't need anyone with herself. She drives, and she just needs sometimes help with stairs, like lifting her, because with the ES we don't do that. Another remarkable case was Joao Becker. We can also follow him. He also loves people write him. You can find him on Instagram. He's a patient from Brazil. He's a thoracic. I remember he's T5, T7, spinal cord injury. And he is a great bodybuilder right now. He walks all the time. He does stepping with his frame, his walking frame. And he does bodybuilding, as I said, right now, but he also does PT. He's a very popular influencer, so you can look for him. He's very nice, and he loves to talk to everyone. So he's doing very good. It's amazing the progress that he's done up to date. He takes steps. And also, Juan Pablo Leñero, he's a great patient. He's T2 level. He was injured in June 2014, and he also walks every day with his walker by himself. He doesn't do PT anymore, which is not that good, but he walks now, so he doesn't use PT. But he does races, and he also does bodybuilding, and he walks for an hour and a half. He's able to go walking from his car to mass, his car to an event. I'd like to highlight that not all patients will be able to do this, but thoracic patients are very fortunate if they're very, very, very efficient in their PT. They might get to a walker take some steps. Okay?
Okay, thank you, Dr. Beatriz. Now, Dr. Nasir, let's talk about LamiSpine. I would like you to explain to everyone what it is and who is it suitable for based on injury level and other factors, and what are the benefits? Does it help to build connections in the spinal cord? What would you tell the viewers about the treatment? From my side, I just wanted to mention that this is our proprietary protocol available also only at Verita Neuro, and we've been successfully delivering treatments, LamiSpine treatments, for 6 years now. Doctor, why don't you explain more?
Thank you, Hanna. So LamiSpine is basically our proprietary surgical procedure which we developed at Verita Neuro. It exposes the spinal cord, so we perform a small surgery to remove a small part of the bone from the back over the level of injury. We expose the spinal cord actually, and we transplant regenerative cells in the spinal cord in a very, very specific location. So there are some regions in the spinal cord which are called perivascular regions. So they're around the blood vessels, and also around on the border between healthy and injured spinal cord tissue, because there is still some life left in this part. It's not a good idea to really perform any procedure in the center of the injury, but rather on the border. So this is where there are some cytokines, some proteins which actually help with the recovery. So this is our procedure. Is regenerative medicine based treatment protocol which we have developed. So it's quite aggressive form of treatment, but usually not everyone is a candidate for this kind of treatment. It's also it comes with some potential side effects. So we are very careful in selecting who could qualify for this kind of treatment. Like I said, not everyone qualifies, and many patients, when they qualify for epidural stimulation, normally LamiSpine is not recommended in those patients. But some patients, they do get both a combined protocol with epidural stimulation and the LamiSpine procedure. So after LamiSpine, we also have a very specific rehab protocol where we do a lot of external electrical stimulation, because electrical stimulation is still a very important part of our day-to-day work. So we use electrical stimulation, electromagnetic stimulation, extensive rehab, locomotor training, and LamiSpine treatment also can restore a reasonable level of functions, even in patients with complete spinal cord injuries. So this is a second protocol available at Verita Neuro after epidural stimulation.
Thank you, Dr. Nasir, and back to you, Dr. Beatriz, for the stem cell therapy. Please explain to us, what is regenerative approach? Who is it for? Is it for early cases or for chronic spinal cord injury cases? And what benefits might patients see?
Yes. Okay, so the stem cells, which is regenerative medicine, it's a good option, especially for acute cases. We've seen very, very, very good results in patients in acute phase, which is the first year and up to the 2 first years. But we have stem cells, you might want to know, that have 3 specific characteristics, which is anti-inflammatory, regenerative, and also regulates the immune system. So that will help a lot with the acute phase in the patient. And we've been invited many times to present our cases, because they have been very fortunate in acute patients, because 95%, along with the therapy and the pelvic floor therapy, regain autonomic control. That is bladder and bowel and sexual function with stem cells. So that's a big, big, big change. As I've told along all this live session, patients and relatives first are impacted by the mobility issue, but autonomic complications are then become more important. It's very important, and it brings a lot of compromise to ask for help to use a diaper, or to help you with your bladder, or having an accident in a public scene or at your work or whatever. So we do believe that it helps a lot, regenerative medicine, in autonomic functions. In reality, our stem cells, which are cultivated in a laboratory scenario, don't have genetic information. So we don't have a limitation in patients to use them. You won't have tumors, you won't have cancer, you won't have any genetic information from the stem cells that will harm you. The biggest secondary negative effects would be headache, maybe being a little bit sleepy, and maybe a little bit of pain in the lumbar puncture site, because that's the via that we use to give the stem cells. That's the best way. They are heterologous stem cells. They are mesenchymal stem cells. And we have a very, very good case that I think everyone would be very happy to know. This was a patient, 17-year-old patient, that went surfing to the beach on December last year, 2 years ago. And so he fell and he had a fracture, a spinal cord injury. It took around 18 hours to bring him to Guadalajara, because it was out of Guadalajara, the beach. He had the heart worrying, and they told him what most patients receive as a news. You have a spinal cord injury, it's probable that you'll never walk again. And imagine his parents. He was only 18 years old. He was about to get to college. So they went right into the computer and started looking for the most new treatments. So they found Verita here in Guadalajara, and they called us, and we were very fortunate to be able to go and evaluate him at his hospital at day 10 after the injury, after he had his surgery. And then He was discharged from the hospital where he had his surgery. And after 12 days after his injury, he came to our clinic for a 35 acute program with stem cells. And after the 35 days, this kid, because he was a kid with 18 years old, he was able to walk with a walker from the clinic, controlling voluntarily bladder, bowel, and sexual functions. Also, his sensation in all his body, he regained it, and up to date, it's 2 years from his injury, but when he was 6 months, because we've been doing follow-up every 3 and 6 months in the beginning, now we do it every 8 months or a year. He had stem cells 3 more times after that, and now he doesn't even remember what was a spinal cord injury was, because he's in college, he drives by himself, he walks by himself, he voluntarily controls sphincters, and he only has this, well, his parents, because not even this kid has this memory of the spinal cord injury. So he was very fortunate to be here in acute. Also, we have patients, for example, I can remember a patient that was 10 years from the spinal cord injury, and she regained autonomic functions, also the pelvic floor functions, and she was very happy that even after that time, she also got some sensation in her legs, and we lowered we gained 5 levels lowered of her spinal cord injury. That means that if she was a T5, then she was a T12. So she regained some functions. So stem cells is a good option for everyone, no matter if you're acute or chronic. Obviously, we have to make a thorough evaluation, but they're very benevolent.
Thank you so much, Dr. Beatriz. I really love the examples you gave. The treatment of the boy you mentioned, I think this is a moment all of us remember very well. For all of you watching and listening, you can actually see him on our social media walking out of the clinic towards the end of the treatment. So I would encourage everyone to go through our socials and see the testimonials of our patients. We usually tend to post quite a bit. Whoever is open for it, we do record them and we monitor the progress. So you can see some amazing success stories in our social media, but also in our website, veritaneuro.com. We still have around 10 minutes to take the questions. So maybe I'll start with some of the questions I already saw left in our chats. And I'll ask both of you doctors, maybe one by one, to answer them. I see we also have some questions in other languages. We will definitely make sure to reply to you in writing, as we do not have capacity to answer everything, all the languages here during the live. But let's start with the first question. I think I just answered it a minute ago from Ciro. Ciro is asking if there are any testimonials of people treated with complete spinal cord injuries. Ciro, absolutely yes. Honestly, most of our patients treated with epidural spinal cord stimulation are actually patients with complete injuries. So you will see video testimonies in our social media and our website, but we also do have access to case studies that might be very interesting for you, where we monitor the progress and the treatment very meticulously. We have medical grade data, so this is something you will be definitely interested in. We have another question here from Lekan. Lekan is 56, from Nigeria, sustained C5 to C7 spinal cord injury since December 2020. And Lekan would like to know if they still can be helped. We can, of course, review all the details. Dr. Nasir, would you like to evaluate about the treatment of spinal cord injury?
Yes, thank you, Hanna. I think, well, absolutely, looking at the location of the injury, simply it's possible for us to provide at least one of the treatment options. Usually patients with C5 C6, C7 spinal cord injuries, they do qualify for epidural stimulation. It depends on the hand function, so it's difficult to answer without proper medical evaluation. But if there is reasonable upper body function, which is spared in some patients with C6, C7 injuries, then only the lumbar stimulation would be recommended to restore locomotion in the lower limbs. But if there is significant loss of hand function, then we actually need to make another assessment about the health of the spinal cord tissue at lower cervical level, which is C6, C7. For some patients with this level of injury, they may qualify for 2 stimulators. So it depends on what does the MRI scan look like, and of course, what does the hand function look like. So based on those 2 factors, we can decide whether a single stimulation would be beneficial, or maybe we would have to implant 2 stimulators. But definitely, I would say epidural stimulation, just simply looking at the location and traumatic injury, yes, it could be offered. And I think 56 is not it's 56, right, Hanna? You ask the age.
2020.
Yeah. So
The 56 years old.
it's also not too late, but I think age, if patient is 50, 55 years old, but in general good condition, then it's not a significant factor. The treatment could be provided. I think we probably had some connection issues with Hanna.
There. No?
Okay, so I'm not sure if there are any.
I'm not
other
able to see her.
Okay, I think she will be here shortly. Because I'm also looking at the list of questions here. So Dr. Beatriz, one question I got from Edgar is, how does the epidural stimulation device work? So maybe Dr. Beatriz, I think maybe you would
As
like to
I
answer.
mentioned, the epidural stimulation amplifies the electrical circuits that we still have when there is a spinal cord injury. And so we find the pulse or the combination in this pulse in order to amplify this signal and make like an electrical bridge so the patient will regain this voluntary movement. So that is why it's okay if you are a complete or an incomplete injury. Spasms are a good clue for us to know that there might be some circuits that we will be able to amplify. During surgery, we do a test to see if there's a signal that is coming and it's being able to be amplified. We answered Edgar's question, Hanna. Okay.
Thank you. I lost a moment, but I'm back with you. I see we have another question. Dr. Beatriz, maybe you can answer it as well. Are all the treatments we discussed today, are they done alone or in combination?
Some of our treatments are in combination. For example, usually we do ES, the epidural stimulation, with regenerative medicine. We've seen along the years that it's a very good combination, since the ES will help a lot with gross motor voluntary movement. However, it helps a lot the stem cells with the autonomic functions. This is the bladder, bowel, and sexual impairments.
Absolutely. Dr. Nasir, I see a question from Ahmed asking if stem cell treatment spinal cord injury 10 years post-accident.
I'm sorry, Hanna, could you please repeat the question?
Sure. The question is about related to treatment. If the stem cell therapy can help with regaining functions for a case 10 years from accident.
I think it's tough because it depends on 10 years is a long time from stem cell perspective. I would say from epidural stimulation point of view, it's really not that significant because epidural stimulation works in a different way. It basically takes the spirit signals, like Dr. Beatriz explained, and it amplifies those signals. From stem cell point of view, 10 years might be, it may still be possible to see some recovery, but it's difficult to say without looking at the MRI scan. So I would say if it's an incomplete spinal cord injury with significant spared tissue at the level of injury, then the chances are significant. But if there is like a major transaction, complete or near complete transaction of the spinal cord tissue with a lot of like cystic changes in the spinal cord, or maybe spinal cord atrophy, which is like thinning of the spinal cord tissue, then I think it's probably going to be very hard. So usually for those patients, if they have like serious traumatic injury, we normally go for epidural stimulation as a primary option with some supplementary regenerative medicine treatment.
Thank you, Dr. Nasir. I see we still have a few questions left, and we will definitely get back to everyone in writing. I know that many of the social media do not support for 1 hour. This is why I wanted to thank you, doctors, for this amazing panel and for all the knowledge you've shared today, and all of the expertise you brought with you to the live. And thank you everyone who joined us to listen to our spinal cord injury awareness live Q&A. From my side, I just wanted to let everyone know that the treatments we discussed today, they are available. If you would like to connect with Verita Neuro team for a consultation or more information, it's really easy. You can find us at veritaneuro.com, and you can also find us in social media. So just drop us a message and we will definitely get back to you, and we will help you every step of the way. We have facilities in Guadalajara, Mexico with Dr. Beatriz, and in Bangkok, Thailand with Dr. Nasir. We are planning to expand more globally. So both locations so far, they offer the same high quality care and treatments with really no major differences in protocols. So we just try to find more and more locations to make it easy for everyone to travel to us to receive the treatment. So please reach out, don't be shy. We are here to help you. This is our everyday life. We work with spinal cord injury patients, we educate patients, try to make a real difference in their functions and in their lives. So get in touch with us, and once again, thank you everyone for joining, and thank you doctors for being with us today.
Thank you,
Wishing everyone a good day and good night. Thank you.
Bye.
Bye-bye.
Bye.